Hello and welcome to World AIDS Day and Giving Tuesday with Nashville Cares. I'm Joy Stafford. I am the Development Strategic Partnerships Manager, and today I am interviewing Dr. Kalams from Vanderbilt University and Medical Center. We are super excited to have you today, sir.
Well, thank you for inviting me.
Yeah. So a little intro for you. You joined the Infectious Disease program with Vandy in 2002. And your current position is Director of Viral Immunology Studies in the Infectious Disease Division, correct?
That is correct. And for the HIV part of that, I am the Director of the HIV Vaccine Trials Unit at Vanderbilt.
Wow, that's amazing. So looking forward to talking to you today about some of those clinical trials surrounding the HIV vaccine research. But before we jump into that, can you give us just kind of a brief overview of HIV, maybe some history, transmission information, and some of the prevention methods that are currently available?
I will. And I think we all... I guess it's presumptuous to think that everybody knows everything about HIV after all of this time, but it's hard to believe how far back it goes. But certainly AIDS was described as a disease in the 80s, right before anybody knew what it was. But honestly, by the mid 80s, people knew exactly that it was caused by a virus. It wasn't lifestyle. It wasn't a combination of things, and there was so much. Well, misinformation continues to this day, but it didn't start recently. There's obviously very good effective therapy right now that's evolved since then. Vaccines have been elusive for a lot of reasons that I'd be happy to go into. It's just such a rapidly changing virus, so it's been a real challenge. But and as far as how it got. Like a lot of viruses, it probably existed in animals, non-human primates, and at some point, just because of exposure to either, no one knows for sure, but somehow it's one of these viruses that jumps the species barrier, and this has happened to, rabies does. There are a lot of viruses that do this, and even influenza, traffics between animals and humans. So that's not too unusual as a virus, but now once it's into the human population, it is transmitted from human to human. We know it's sexually transmitted. We know that it's transmitted by blood products, sharing needles. Unfortunately, because of our innovations in technology and screening, the blood supply is completely safe, which is fantastic. That was an enormous, scary time when people just didn't know if they could get AIDS from a blood transfusion. And right now, we don't have an effective vaccine yet. We continue to test them, but the prevention methods by behavioral changes, safe sex, using condoms, not sharing needles, and now drug prevention, PrEP, right? Good example, which when taken the right way and with better formulations can be quite effective, greater than 90% at preventing infection. So we've made an enormous inroads, but of course, I'm a vaccine guy. I want a vaccine. So I'm continuing to work to that.
That's incredible. Thank you so much for that overview. Great information. And yes, to have PrEP and a 90% effective rate is awesome. But obviously vaccine, like you said, is top of mind for you. So right now, Vanderbilt's a part of a global research effort. Tell us a little bit about that.
Well, Vanderbilt, I can, again, more historical context because some names might be familiar to people, but Vanderbilt has been part of the network to the HIV vaccine network for many, many years. This started out back in the 90s with the AIDS vaccine evaluation group, of which Barney Graham was the director. I don't know if anybody knows his name, but Barney Graham was at Vanderbilt. He's now at the Vaccine Research Center at the NIH, and he had a pretty important role in developing this latest coronavirus vaccine. So I'm going to have a shout out to people. But it does show you that expertise in one area cross-fertilizes other places, right? So all of the technology that we can apply to one bug, one vaccine can be applied somewhere else. But Vanderbilt's been part of this effort since the 1990s. I came to Vanderbilt in 2002, as you mentioned, and I assumed the leadership at Vanderbilt since 2006. And so we test HIV vaccine candidates in anything, what we call, this might be a question you want to ask later, but different types of trials. You know, there are very small trials just to make sure that the vaccine is safe and that it doesn't cause any severe side effects, and that's called phase 1. All the way up into phase 3, where we're really asking the bigger question, does this protect you from getting infected? So we do all of those types of trials in my group.
Wow, that's amazing. So this is that preventative vaccine that will keep someone from being infected with HIV.
That is correct. And I also I don't want to confuse too many terms here, but there's a typical vaccine that you think about. You get a shot, and are you immune to it? But there are other methods of prevention I should mention. You can actually give somebody antibodies. That if I don't want to get too much into the the science and the immunology, but you can actually give somebody the pre-made antibodies. They don't last forever, but they can last for a long time and prevent infection. So think of it kind of like PrEP, but it's not drug. It's an antibody that can last for some time, and that's another. I call it a bridge because they don't last forever, but they might also be protective. So again, I'm the vaccines are what we think more traditionally as something that would give you long-lasting immunity that your own body is making, and with any luck, you wouldn't need to keep getting more and more vaccinations. But that's we'll decide. If we have any kind of success, we'll figure out how often and how long afterwards. So.
Wow, that's incredible. So with your studies that are happening right now, who's eligible to participate in those studies?
If it's called a phase 1 study, and those are really, when we see the label, well, what is that study for? And it's what says safety, and also to see if it makes an immune response. We typically will get healthy people, non-HIV negative, who are like 18 to 49. We have very strict age. We really want to focus on healthy people because you're really looking for any kind of side effects, and you don't want complications from something else causing, some unrelated problem. But with such a small trial and such small numbers, if anything happens, you have numbers. But when you're getting to the point where you're actually testing real world, what we call efficacy, or does the vaccine actually work? In our trials, it would still be somebody who is not HIV infected. And this is now in the era of PrEP. We are enrolling a current study right now called Mosaico, which is really meant to see, are you going to get infected or not? And in that study, we are we're targeting people who have no interest in taking PrEP.
Okay.
And this is kind of complicated to explain, but it's hard to tell whether something works unless you're going to have some people that get sick over the course of the study. So we have to keep counseling people and recommend that they take PrEP, but they have to tell us but I don't want it. And yet we can't, if they want to take it, we will not stop them from taking it. Just let us know. So that's where, if anybody's interested in a study like that, they should talk to one of our recruiters, because I'd be happy to explain that a little bit more. But you can't do any trial to study whether you're going to prevent infection without accumulating some degree of people who get infected. Then you have, and I think more people, if you're studying reading the news about the coronavirus vaccines, I think people are trying to grasp that. Oh, I get it. You got 100 people who are infected, who got the vaccine and who got the placebo. And now I can tell, the people in the vaccine group were protected. It's no different from studying a vaccine, or for that matter, if you wanted to study a drug that prevented heart attacks. I mean, what do? You test people who take the drug and those that don't, and then you compare what happens in each group. I mean, that's kind of the basics that's vaccines 101, right? That's the only way to really do that.
Okay. Well, thank you so much for explaining all of this. So if a vaccine was approved today, would you take it?
I mean, I would. I mean, knowing the way we test vaccines, yes. I mean, I think that if it's done as part of especially like a network like we have, whether it's an HIV vaccine trials network, we're under intense scrutiny. We have consent forms through our institutional review board. It's an ongoing process. It's, like this, if anybody says, I don't want to be a guinea pig, well, guinea pigs don't sign consent forms. I mean, it's not just that you're signing a form. We have educators, recruiters, nurses, myself, people talk. So it's a very informed process. The participant is 100% invested. So it's really a partnership. And so if something's tested that way and an independent monitor who's not associated with the vaccine tells me that this would work, sure, I would take it. So there's a right way to do things and not, so when I hear, in other countries where they just got something, they're just giving it to a whole bunch of people, that's not the way to do it. I mean, I think we're doing it the right way. So the short answer is yes, I would.
That's fantastic.
And I'm enthusiastic, and I'm going to tell you, but again, and now, to say that I can't enroll in any trial that there's a conflict of interest. I can't be in my own trial. But if something were available and then was on the market and I knew it'd been tested thoroughly like we do, I wouldn't have any hesitation.
Right. So with the inside scoop, yes, you would totally do it and recommend it to someone else. You know the ins and outs of how this is done and trust that process.
I would, but I understand there's a lot of skepticism out there, and but all I can tell you is that if people have questions, there's plenty of outreach going on. There are plenty of people willing to talk to you about vaccines. So, just learn about it, get informed, and then you'll be able to make a good decision. So, get your flu shot every year, for God's sakes. I do that, and even if a vaccine was only, even if it only works 60% of the time, like a flu vaccine, you can be down on something like that, but it really does make a difference. And so I'm hoping if we got an HIV vaccine that worked 50% of the time, yeah, I would recommend it, because on a public health benefit, it would be an enormous advance. So, I'd be happy to come and have informational sessions, and I do give these talks like Vaccines 101 and tell people about the different types of vaccines and how they might work and why we're exploring all this different technology.
That's incredible. So 14 years of you working on this vaccine. Do you see that this is, you said 2006?
Yeah, well, that's when yeah, you're right. I've been doing HIV research since 1990, but
right. But
as the head of the vaccine unit at Vanderbilt since 2006.
Sorry, yes, yeah. It should have been more clear.
Coronavirus is easy, right? We already fixed that, so we're not. But again, that's the nature of the viruses. I mean, that's a whole different talk. So.
Yeah. So. I want to say thank you so much for talking with us this morning and giving us some of this information. If people are interested in getting more info about the HIV vaccine research, they can give you a call, or is there a website, and phone number?
There is, and I want to make sure this is the right, I got the 615. Let me make sure I get the right phone number here.
Okay, yeah.
Oh gosh, it didn't. For some reason, it won't let me do that. I know it's 4673. It's Hope. I got to figure out the right. I should have had this.
That's okay. I have 615-322 Hope.
That I believe is correct, but I want to make sure that 322 number is the right number.
And the website would be www.hivvaccineresearch.com.
That part is correct.
Perfect.
Yes. And let me double. I'm sorry to.
No, you're good.
Let's
verify all the things.
Yeah, let me see. Yep, it's 322-4673.
615-322 Hope.
Yep, that is correct. And so
Thank you, Dr. Kalams, for being with us, for sharing all this information, for all the incredible work that you do. And I just appreciate you joining us for World AIDS Day. Thank you.
Happy to participate. Thank you so much.
It's been a pleasure.
Yeah.